as the research core director for the Injury Prevention Research Center at Emory, or IPRCE. And we're here today to talk with you about our summer scholarship opportunities. Let's go to the next slide. So just, thinking about the next hour that we have together, Jonathan Roop is going to be giving an overview of IPRCE. Then I'll talk about the Summer Injury Research Fellowship. We'll have Dorian Lamus discuss the Scott Lilienfeld Injury Prevention Scholarship. We'll go back to Dr. Roop to talk about pathways to practice, and then Mary Elise Cortez is going to just wrap up the meeting with an overview of just what applications are due when. So I'm going to turn this over to Jonathan.
Okay, thanks, Hannah. Very much appreciate the wonderful introduction and your leadership in this. So I'm Jonathan Roop. I'm the director of the Injury Prevention Research Center at Emory. I want to echo what Hannah said and welcome you all to our overview of our funded summer student opportunities. I'll tell you a little bit about our center here, but I also want to emphasize that there are other unfunded opportunities beyond these. So we do facilitate placements in for your APEs, so your advanced practice experiences with some of our partners. So if it turns out that one of these fellowships doesn't interest you, but you still want to do something in injury prevention for your practicum, please reach out to us. We have a list of partners with projects who are looking for students. Some of those may be funded as well. So again, please reach out. And if there's something that you're particularly interested in, you're interested in doing a fellowship in, contact us and maybe we can make a connection. That said, these are our main summer fellowship and scholarship opportunities. So just as an overview of the center, I'm going to speak mostly from what we do for students. So today we're talking about 3 funded opportunities for students to gain knowledge in injury prevention. We also have an injury certificate program at Emory that Dr. Dorian Lamus, who's going to speak later, leads. We support 2 classes at Rollins, so the injury prevention class and the violence prevention class. There's also a short course on firearm injury prevention that's supported by IPRCE. So I encourage you all to get involved in those if you're Rollins students. And so I think I will, in the interest of time, stop there and pass it off to, I think, Hannah, are you next?
I'm back up.
Yeah.
That's right. All right, thanks. So I'm going to talk about the Summer Injury Research Fellowship, which we call SIRF. I did not come up with that name because I am terrible at acronyms. So we have a wonderful student from last year who came up with the SIRF Fellowship name. And SIRF, we typically fund 2 different lines or 2 different fellowships within SIRF. One is funded through IPRCE, and then the other is funded through SPARK, which is the program on substance use disorders at Rollins. And that one typically focuses on overdose prevention. Let's go to the next slide. So overall, the purpose of the SIRF Fellowship is to strengthen injury prevention and response in Georgia and to train the next generation of injury prevention scholars and practitioners. Overall, this is a 10-week paid fellowship, and the start and end dates are flexible. We're typically looking at mid-May to July, or early June to 10 weeks after that, whatever works with the students and then also with the placements. And fellows complete an injury prevention project with a non-governmental or governmental agency within the state. We have, since our inception, partnered closely with the different injury branches or departments within the Georgia Department of Public Health, and we have the pleasure of doing that this summer as well. We have, for each of the fellowships, we have a agency mentor and then also an Emory faculty mentor. The Emory faculty mentor is me, for better or for worse, and we get to meet every couple of weeks to share reflections on the placement, raise up challenges, and also support one another and think about how to best use the placement to develop a future career. after you graduate. And we always work with the Georgia Department of Public Health, with our colleagues there, to ensure that the fellowship is going to culminate in some kind of a deliverable, whether it's an evaluation, a manuscript, a report, some kind of curriculum. Just go to the next slide. So in order to be eligible for a SIRF fellowship, you have to be a full-time master's student. Could be an MPH, but it does not have to be. And you need to have at least one more semester of coursework left after the end of the SIRF fellowship. So this is not the right opportunity for you if you were graduating in May or in the spring of this year. And you have to have particular skills in order to be a good match for this kind of fellowship. You need to have an understanding of the epidemiology of injury, and also a knowledge of the impact of injuries on health and society, and finally an ability to identify and apply public health strategies and principles for the primary and secondary prevention and control of injuries. Let's go to the next slide. So we wanted to give you a sense of what our fellows have done in the past. We have one fellow who is here. She'll speak in a moment about what her placement was like last year. Stephanie Verna was our other fellow. She had the pleasure of working in the Child Occupant Safety Program, and also with the Over 55 Driver Program. And her projects, she had 3 different projects. She researched messaging campaigns and dissemination strategies for seatbelt and car seat safety. She designed a monthly newsletter for drivers who are age 55 and above. And then she also designed a social media toolkit that ended up being featured on the Georgia Governor's Office of Highway Safety. So she had a really diverse and I think quite productive 10 weeks with us. We'll go now just to hear from Lauren, who was our other fellow, and she worked in the opioid and substance misuse response team. And Lauren, I'm going to pass it over to you.
Thanks, Dr. Cooper. Hi, everyone. I'm glad to be here today. As you can see here on the screen, I had the Overdose Prevention SIRF Fellowship this past summer. My work was in their overdose prevention team at DPH, and in that role, I helped with 2 different projects. One was more on the quantitative side, working on a analysis of their disparities in overdose morbidity, specifically looking at racial disparities across the state of Georgia. And then the other project I worked on was looking at survey data across ERs in Georgia to try to identify ways where evidence or places in which evidence-based prevention strategies were not being used, and provide literature and resources for emergency room staff to improve their practice and include more overdose prevention materials. I think I had an amazing time in the fellowship. Just for starters, I can speak more if anyone has specific questions about my role and what it looked like. But I think the biggest learning for this fellowship for me was just experiencing DPH and how they worked and how many individuals are on this team and how professional it is, and everything comes together, create these massive efforts and campaigns. And I think it really gave me a practical lens into the field of public health, and specifically the coordinated effort that's being put towards opioid and substance use right now. Thanks for having me.
Sure, Lauren, well, thank you so much. And we're going to have, I forgot to say this, we're going to have Q&A after we describe each fellowship. So Lauren, if you could maybe stay on for the Q&A about the SIRF fellowship, I think that would be lovely. And so, now that we've talked about the eligibility and the nature of the fellowships, you've heard a little bit about what folks did last year. I'm going to now be turning this over to our wonderful partners at the Georgia Department of Public Health. And they're going to be talking about possible placements this summer. As before, we're going to have one placement in the Division of Health Protection and Safety, and then we'll have another in the Opioid and Substance Misuse Response Program. And I think I'm going to turn this over first to Tracy Reese and Liz Head, and they will talk about the placement with the Division of Health Protection and Safety.
Absolutely. Thank you, Hannah. I'm going to share my screen here in a moment. As soon as this one comes down.
I'm going to start by saying that I am legally parked. Yes, I'm in my car, but I'm legally parked and we're being very safe right now. Just put that out there for everybody.
All right.
Okay, so my name is Tracy Reese and I'm the program manager for the Child Occupant Safety Project. We are fully funded through Governor's Office of Highway Safety, and we focus on occupant protection for our kiddos. So we really look at those folks age 14 and under. Stephanie was my intern last year. She was absolutely amazing. I'm just gonna say that part of that experience is what has made us so excited about moving forward this year, because it was really, really fantastic. So our project this year, we're really looking for it to be basically 3 phases. That kind of the first phase is going to be this data review and target mapping. Second phase is going to be cataloging. And that third phase is going to be our evaluation and report out. So starting with this phase 1, once the 2020 FARS data is released, whenever that may be, at whatever point that is finally released, we're going to be looking for our SIRF intern to start looking through that, doing some analysis of how that relates to our child occupants. We want to try to do some GIS style mapping of the fatalities by county, and then we would like to do kind of some layering of that map, maybe an overlay of our current child passenger safety technicians and instructors across the state. So that'll give us an idea of where our major resources are and where our significant needs are. Next slide. Once we get that information, we're going to kind of move into the second phase, which is the cataloging. We'd like to identify our top 10 targets. So we'd be looking at the counties that have a high fatality rating coupled with a lower technician or child passenger safety instructor count. Once we get that information for those target sites, we really want to build a good database with what are the local child cares, like our daycares, our Head Starts, what are the local after school activities, and what other injury prevention resources are already available in those communities, whether it's a Safe Kid Coalition, trauma centers that have injury prevention outreach kind of along that path. And then we'd like to start to catalog, as we look towards the National Child Passenger Safety Week in September, what are the national, state, and local resources that are available? Are there new media toolkits that are coming out? Are there new marketing strategies? What is all that information? We want to bring that together. Next slide, please. And then we get into kind of our phase 3, which is the evaluation and our report out. So our deliverables, we would be looking for that target map that we talked about, the catalog of our existing and potential partners for these outreach activities, a catalog of the available resources, and what is going to kind of be a pseudo media toolbox for our local partners, and then a survey to evaluate the effectiveness of the local engagement. Next. And then for the report out, we'll do what we did last year, which is our intern will serve as a presenter during our 2022 CPS Week planning webinar, which will go for all of our statewide partners. They'll talk about what they did, how we targeted specific locations, the resources that they've gathered. And then we'll also do a project deliverable report out for the next upcoming JIPAC meeting, however that one falls within that, in that specific timeline. So really, I kind of just wanted to throw this out here because it's just so you can see how it's going to relate back to some of these activities. So there's going to be a lot of communication outreach. You're going to be doing some system thinking, some program planning, but the biggest chunk of this is community dimension. I really can talk, y'all. Community dimensions of practice skills, finding those different partnerships so we can start to leverage those and kind of piece those together to build a bigger local network to cover what we're trying to do for National Child Passenger Safety Week.
Okay, thanks, Tracy. Are we taking questions now, or are we just flying through the different projects?
Good question. Now, Tracy, I believe, has to sign off relatively soon. So what if we take questions for her now, and then maybe Liz, if you can stay on, maybe we can take questions about your project and the overdose project.
Yeah,
after the
absolutely.
overdose project.
Of
Okay.
course.
Yeah. So what questions might you have for the project that Tracy just described? You can drop these in the chat or raise your hand or speak out.
Hi, I have a question. Hi, my name is Stephanie. I was curious how much of this internship is going to be in person, online, kind of that breakdown.
So for this particular project, you will mostly be able to do everything online. Our intern last year did the majority of her work while living in North Carolina. So honestly, I'm not even sure that Stephanie and I have even met face to face yet, because everything had been virtual as we were working through that. So yeah, so there's going to be a lot of flexibility in terms of it being virtual and being able to work through that. But as our building and our offices start to open up, there would be the opportunity to come in person if that's something that the selected person was interested in doing.
Thank you.
Sure.
Other questions for Tracy? Okay, I think we can move on then, Liz, into the BOLD project.
Sounds good. Hi, everybody. My name is Elizabeth Head. I'm the Deputy for Injury Prevention here at DPH. I manage all of our healthy aging projects. And I actually wanted to provide a little bit of a background, because BOLD, which stands for Building Our Largest Dementia Infrastructure, is really sort of new to the public health sphere. This is all about how public health fits into the existing work and systems and framework that is aging, healthy aging, dementia, including Alzheimer's disease. So we received one of 5 enhanced awards under this BOLD funding out of CDC. The initial funding was a total of 16 funded awards. They've actually added 7 more core capacity awards for years 2 and 3 of this funding. Our project, because our goal is for all Georgians, their care partners, and the professionals that serve them to be seen, we have entitled the project Georgia Be Seen. So we want to be bold using systemic education, evidence, and networks. This is a 3-year grant. We use all of our usual public health approaches to work on dementia risk reduction, early detection, caregiving, and educating professionals. All of this comes from the CDC Roadmap for Healthy Brain Initiative. They focus on policies and partnerships, education and empowerment, competent workforce, and then, of course, monitor and evaluating, which is basically data. For the purposes of this internship, we're going to focus on the partnerships and education and then the data piece. But that data piece is actually going to help us assure a competent workforce. And I'll tell you how we're going to do that. To dive in first to partnership and education, the sort of first facet of this is to participate in the overall healthy aging team work that we're going to have over the summer. Our intern can pick as many of these as they want. I wouldn't do all 4 because it's going to get overwhelming, but I would certainly pick 2. We've got a lot going on in our fall prevention world, which is also, by the way, a task team out of the Injury Prevention Research Center at Emory, some safety walkboards that we're developing, webinars that we'll be hosting over the summer. So there'll be lots of opportunities to interact with professionals in the field. Our 55+ driver safety project has a lot of exciting online opportunities, some in-person education opportunities in terms of educating communities, but that is really, really sluggish due to them being the most vulnerable, one of the most vulnerable populations out there for COVID. We're through BOLD, we're doing a lot of dementia-friendly outreach, so it will be helping some of our partners talk about and create some materials around dementia-friendly that can be easily distributed without too much effort. And the same goes for telesavvy caregiver at home. We're going to be really rolling that out hard and heavy. And so we want some documentation, some PI&E type of materials built around that. So you'll be helping us with that. In addition, some pre-planning and event facilitation for virtual dementia tours. which is its own exciting opportunity to kind of figure out what it's like to have to do tasks if you had some of the symptoms of dementia. So we're working on scheduling those so our intern would have an opportunity to participate in one or two of those. That's our partnership and education work. In addition, looking specifically at data, we need a how-to for ACEs data retrieval for our aging network partners, very specific to relevant comorbidities for dementia and Alzheimer's disease. We want these folks to engage their passion, but to do so in a data-driven way. So the easiest way to do that is to create a PowerPoint, a how-to of our public-facing data website using examples from relevant data so they can get excited about it. We want our person to conduct an environmental scan of profiles for vulnerable populations that exist in other states. What do those look like? What are they including? What could we do in Georgia? And then based on that environmental scan, create and update some visualizations based on what we're seeing elsewhere for relevant risk factors and comorbidities. Our deliverables for what I've talked about are a PowerPoint presentation template that would be used and distributed to partners, a draft, a profile for a 55 plus population of Georgia, risk factors, existing programs, et cetera. It wouldn't be the be all end all, it would be one item. Otherwise that would be its own full-time job. We want a catalog of ready to go data visualizations for partner use and a training guide for incorporating virtual dementia tour into emergency planning. Just the fringes of that particular project, but it's very exciting to bring in another public health professional talking about dementia. Our end of project report out is pretty much the same. We want our students to be able to present and to present at our GUARD Collaborative, which stands for Georgia Alzheimer's Related Dementia. That's our whole statewide group. And of course, to present at GPAC for all of our injury specific partners. We also have very similar core competencies on here because you are practicing a lot of skills, including which time management is going to be a thing that you're practicing here, and also learning how to prioritize some of these projects. No expectation that you finish some huge laundry list of things, but that you pick and choose the things that you feel like you can get done. And that's what we have. Does anybody have any questions about that? Or Hannah, did you want to move into the next part first?
If you can stay on for a few minutes, let's turn to the Okay, wonderful. Thank you. Because let's hear from Katie Casa about the SIRF Fellowship placement in the Opioid and Substance Misuse Response Program. And Katie, if you have your own slides, you can share them, or we can go back to the slide deck that we created that has an overview, I think, of the project.
Yeah, the main slide would be great. Thank you.
Great. All right, we can do that.
Okay.
Mary Elise, are you able to call those up?
I apologize. For some reason, it's not coming up. Okay, there it is. Let me try one more time. Are you able to see?
No, we're seeing your, it looks like maybe it's your Outlook
Reminders.
calendar instead of the, I might be able to pull it. Let me also see if I can pull it up too. Hang on.
I don't know why. Huh.
I think I got it. Give me a moment.
Okay, something's going on with my file.
Sure, no problem. Here we go. And
I think I got it. Let me see.
can you guys see?
Oh, perfect.
Okay,
Perfect.
beautiful. All
Thank
right,
you.
Go ahead. Thanks for being
Okay.
with us.
Thanks so much. Hi, everyone. My name's Katie Casa. I am the program coordinator on the drug surveillance unit, and our team sits within the opioid and substance misuse response program at the Georgia Department of Public Health. My team and I had the pleasure of working with Lauren last summer, and we're really excited to have a SIRF student this summer as well. So happy to be here. Just wanted to kind of start with an overview of our program and what our teams do. The Opioid and Substance Misuse Response Program, or the Opioid Program for short, is housed within the Division of Health Protection at DPH, and the program is responsible for leading statewide strategic planning efforts to respond to the opioid epidemic, as well as emerging substance misuse in Georgia. The program also includes the Drug Surveillance Unit, which is the team that I work on, as well as the Prescription Drug Monitoring Program. And the SIRF projects will kind of touch all of those various programs. So we'll definitely get a feel for the various aspects of what the opioid program works on. And the Drug Surveillance Unit more specifically monitors over in Georgia and provides drug surveillance data both to the public and to partners who are working on the drug overdose epidemic. All right, next slide, please. Okay, so the projects that we have in mind for the SIRF position this summer, there will be two projects. One is with the Drug Surveillance Unit. So as part of that project, the student will work with staff from our team on an innovative analysis that involves our various drug overdose surveillance data sources. Those include death certificate data, emergency department admissions data, and hospital discharge data. So our team uses those data sources in a variety of ways right now, but this would really be a novel analysis, kind of using those data sources to validate each other and to look for spatial and temporal trends across those different data sources. So we are imagining that the end deliverable for this project would be a report on the outcomes of the analysis, and we hope to be able to use that report to improve our surveillance and our case definitions and to share with our partners. So the second part of the project would be with the Opioid and Substance Misuse Response Program and the PDMP program. That would involve assisting with the design, implementation, and analysis of a Georgia statewide prescription drug monitoring program, or PDMP integration user survey. So that is about our ongoing efforts to integrate the PDMP into medical records to make PDMP use more convenient for clinicians. So the survey is just meant to assess overall satisfaction with that process, as well as any existing barriers that are preventing facilities from fully integrating. So the survey would be designed to gather both quantitative and qualitative data. So the skills that we're really looking for in our ideal candidate would be strong quantitative data skills. Our team generally uses SAS or R, so proficiency in either or both of those would be really great. We're also looking for strong survey design and implementation knowledge, qualitative data analysis skills, and mapping skills if you have them. It's not required to have mapping skills, but that would be a great bonus. So yeah, that is an overview, and I'll stick around to answer questions.
Thank you so much, Katie. I have to say that I would love all of those fellowships. I might be applying for these jobs. You might see me showing up on your doorstep this summer. The SIRF fellowships are due on the 18th, and we have that relatively soon due date because we engaged with GDPH in the interview process. The information on the application is here, and there is an online form. Mary Elise is going to share that with people, with everyone who came to this, who signed up for this event. I want to take, I think we have a couple of minutes for questions and about either any of the SIRF fellowships. And so I'm going to stop sharing and open this up for questions while we have Katie and also Liz on the line, and Tracy, perhaps, and Tracy as well. I see she's able to be here. So speak up, or you can add a question into the chat. I'll also monitor hands raised.
You know, there was a general question I received in the chat about letters of recommendation for SIRF. Recognizing that that is about a week out, there was a student wondering if there was some flexibility around that, considering, sometimes faculty may need a little bit more time.
Here's what thank you so much for asking that question. Here's what I would say is that what if we waive the letter for the applications due on the 18th? If you move forward into the interview process, then we'll request the letter. What if we do that? Okay. Thank you for asking that. Interesting. So we have a question about, are all US visa authorizations eligible to apply? So with this, I'm going to move to our GDPH partners from a SIRF fellowship. That's yes, they are, but I want to shift over now to Liz, Tracy, and Katie.
I would think so. Happy to ask for that, since they would be paid. They'd have to go through our hiring process, which is different for interns. So I will double check, but my initial answer is yes. Katie, I didn't know if you had any different experiences on that.
I would also need to follow up, but I'm happy to do that.
Thank you so much. We can share the information in an email that we send to everyone who signed up. That might be a question that is of interest to many people. I think we have time for one more question.
Hi, I have a question. I think this might be for the student. She's still on, right? Is it Lauren? Maybe. Lauren.
Yeah, go ahead.
Hi. So I was wondering, kind of, what was the most, I don't know, impactful thing that you learned that you think you'll take with you into your career? Like, what can I expect to gain from this internship, from kind of the student's point of view? Thanks.
Yeah, definitely. I think it would really depend on your previous experiences and what you bring to the table. I think I did have this understanding of the quantitative component and the surveillance that the DSU is doing on a daily basis. So I gained a lot from speaking with their biostatisticians, learning about syndromic surveillance, all of the different ways that they collect data and how these different types of data impact their ability to address overdose challenges. I also, like I said before, I think the biggest thing that I took away was like my first couple weeks, I just met with everyone, and it really laid the land for me. What do these roles look like for public health professionals, and where can I see myself in this team? And so I think that those two pieces are my biggest takeaways and my biggest learning lessons as far as like where I see myself in this field and in public health.
Thank you so much.
Thank you, guys. We have to wrap up these questions so that we can move into the next fellowship. And so I'm going to go ahead and share my screen again. As I do that, I want to just say that I'm turning this over now to Dorian Lamus, who's going to be discussing the Scott Lilienfeld Injury Prevention Scholarship. Dorian, take it away.
Thank you, Hannah. So I'm Dorian Lamus. I'm the Director of Education and Training at IPRCE and the Director of the Certificate Program. And today I'm just going to briefly tell you a bit about the Scott Lilienfeld Injury Prevention Scholarship. And just a little bit of background, Scott was a pioneering psychologist, a really great guy. He was integral in our success as a certificate program and as just the general program. He unfortunately he passed away of cancer about 1.5 years ago, so we named this scholarship after him. So the scholarship is designed to recognize and assist and train students working on injury-related research and practice-based projects. And one important thing to note is that all of the projects must be applicable to an injury problem in Georgia. So some examples of this is could be violence prevention. So anything from dating violence, sexual violence, and partner violence, childhood maltreatment, suicide, youth violence prevention, including media influence and bullying. It could be motor vehicle crash or crash injury prevention, traumatic brain injury, falls prevention, or drug safety. So those are our five kind of main focus or main components of IPRCE. But it doesn't necessarily have to be one of these five, as long as it's a project having to do with injury in Georgia. So how to apply for this scholarship is the application tab is on our website under education and training under the fellowships and scholarships. You have to submit your CV and resume, a short project proposal, letter of support. Or would we possibly waive that given that it's February 28th deadline? I don't know. We can, if you have any questions, please email me. We'll kind of figure that out. And then I'm sorry. And then a letter of recommendation. That's what I meant to, that's what I was talking about. And then a complete application form again, which is on the website. And if you were to get the scholarship, you receive a $1,000 stipend, which is distributed at the start of summer. You'll get a scholarship certificate, and most importantly, you'll have an opportunity to interact with local injury and violence control or injury control and violence experts, and you'll be recognized on our IPRCE website. So more information about the scholarship can be found on our website. And if you have additional questions, you can feel free to email me. My information is on the website as well. The deadline, again, is February 28th, so about 2 weeks from now. So I hope that you find the scholarship of interest and we received some applications, because it's really an excellent opportunity to further your knowledge and experience in injury violence prevention.
Thank you, Dorian. We have a few minutes for questions from the group.
Somebody says they're having trouble locating the application. It will be live in the next couple of days. We recently updated it. So anybody who registered for this, I will send it out via email early next week, if not sooner. And you can also check back on the website. It should be up by Tuesday at the latest. You're welcome.
Hi, this is Philip. Nice to be here, and thanks for all the presentations today. This seems like amazing opportunities. I'm an executive MPH program student, so I'm actually coming to you from California. I work in traumatic brain injury research at UCLA. And I was wondering about, for the scholarship project, is that something that we come up with on our own? Is that something that we could maybe discuss with folks in the group to see what projects might be available to kind of jump onto? Or is that something, again, that we kind of come up with ourselves? And then also wondering the distinction between the letter of support and the letter of recommendation for that.
Those are both excellent questions. First off, to your first one, it could be, you could come up with it on your own, or, in consult or in collaboration with an advisor, mentor, or someone in the area of injury and violence prevention. So there's not like, it could be a project with, a mentor, or, but we have received applications of projects of someone coming up with them on their own. Usually you have to have data, or at least proposed data. So you kind of often want to partner with an organization that you can work with. And again, in Georgia is, it has to be in Georgia. So, I mean, I love that you're coming from UCLA, but and on this one, it needs to be applicable to at least Georgia. Jonathan, were you going to say something?
Yeah, so I was going to emphasize that we have in the past allowed people working on out-of-state data sets with the caveat that the results need to be directly applicable to a problem in Georgia. I'll also add, so Dorian, did you want me to address the difference between letter of support and recommendation?
Oh, sure, you can do it.
Yeah, so typically with the letter of support, we're looking for like feedback from a previous research mentor or somebody who supervised you in a previous position. The letter of recommendation, I could have these reversed, but the one of them is, the other one would be, we're looking for information from the person who you will work with on this project. So say, for example, you're working with a faculty member. The purpose of that is just really for the faculty member to say, yes, I am willing to support this project. I will say that the Lilienfeld scholars in the past have primarily been people who, with a little bit of extra money, can add something to work that they're already doing. There have been people who have done sort of de novo work. That's also perfectly acceptable, either or. So.
Lovely. All right. We have time for one more question. If there's questions. Oh, yeah. So is this does this qualify as an applied practice experience for RSPH students?
Does the Lilienfeld scholarship?
The SIRF ones definitely would. I don't know.
So the Lilienfeld could go either way, depending on. So if you are paired with a mentor who agrees to act as your APE mentor, the Lilienfeld scholarship could certainly support that. Again, it's meant to be a supplement,
right?
To just to support something that you're already doing. And so if you had a mentor and you were working unpaid in an APE and you wanted to be paid, you could apply for doing something like this, right?
But standing alone, the Lilienfeld scholarship wouldn't, like, you have to have a certain number of hours for an AP, and
right.
Wouldn't,
yep.
Satisfy that.
Good point. Yep.
Well, this is a perfect juncture for us to then move into the Pathways to Practice scholars. Let me pull up the slides for that, and Jonathan is going to be leading us through that.
Okay, thanks, Hannah.
There you go.
So I want to start by really acknowledging our partners at the Region 4 Public Health Training Center who are sponsoring this. I am serving as mentor on this, and so I'll talk a bit about the project. The project itself is working with myself and our colleagues at the Georgia Department of Public Health on a CDC grant that's focused on preventing adverse childhood experiences. For those of you who are not familiar, adverse childhood experiences are traumatic experiences in childhood that have a dose-response relationship to adverse health outcomes, well, behavioral outcomes as children and teens, and then those behavioral outcomes are associated with health behaviors and decreased health as an adult. And that decreased health is associated with early death. So ACEs have a dose-response relationship with chronic disease, employment, educational attainment, and many other things related to health, long-term health. CDC focuses a lot of their injury prevention efforts on ACE prevention because ACE prevention affects so many other injury problems. So IPRCE's role on the Preventing Adverse Childhood Experiences Data to Action grant is really surveillance and dissemination. So we're taking ACE data in Georgia and bringing them all into one place, analyzing those data so we better understand local risk and protective factors, and then developing health communications that are targeted at community partners who are engaging with the Department of Public Health, the Georgia Department of Family and Child Services, and Prevent Child Abuse Georgia through the Essentials for Childhood framework. And so Essentials for Childhood is a state level framework that brings together numerous partner organizations who are focused on improving child well-being. And so an intern's work on this will be analyzing ACE data, as well as helping us develop health communications that are targeted towards partners, updating our website. And I'll put the website address in the chat so you can see some of the things that we've already done. There's a set of fact sheets up there that our previous Pathways to Practice scholar, Lauren Amidon, put together. Lauren did a wonderful job of really taking health communication skills and principles and applying them to a set of health communications that are targeted at local partners with the goal of providing those partners with data and other information that they can use to implement child well-being strategies contained in the state's strategic plan for preventing adverse childhood experiences. I know this was asked previously, so this internship can be virtual or it can be a hybrid, a virtual and in-person. We're open to either. Virtual certainly works without much of a problem here, but the hybrid is also fine if you want a chance to interact in person with some of the team. What do we bring to students in this? Well, first is exposure to ACE data. There are some data sets that we're using here that simply aren't available elsewhere. We're looking at small area reports of cases of abuse and neglect, which is a really hard data set to get to, but has so much relevance to ACE prevention. Trying to figure out how you can access and make those data available is something that that's really a focus of this. The other thing that I didn't put on here that probably should have been is data literacy. So we're working with community partner groups and really trying to equip them with the skills that they need to first select appropriate data that can act as indicators for the success of their programs, and then help them learn how to access and disseminate those data sets to their partners. And so the student will have the potential to work in sort of all of these areas. So health communications, or really sort of more epidemiology, and even somebody with a biostats background could do work on the data sets. There's a lot of different ways that this could go. So one thing I will note is that the Public Health Training Center is trying to close the application to this very soon. So if you're considering applying for this, reach out to them directly. And if you apply and don't get it and are still interested, reach out to me directly. I have some spots to support students on this as well. So I think I'll stop there and see if there are any questions.
Thank you, Jonathan. So fascinating. So again, folks can put questions into the chat. You can speak up. I'll also monitor if you want to raise your hand. Okay, well, we can fold questions in about the Pathways project with any questions that folks might have about the Lilienfeld scholarship or about SIRF. We can open it up to questions across opportunities now. Okay. Okay, so yes, are the fellowships applicable to an APE? So SIRF is applicable for an APE. Lilienfeld, it really depends on the, Lilienfeld is kind of a supplement, so it really would depend on what the core project was. And then Jonathan, I don't know if you mentioned this for Pathways. Yes, so that's a nod from Jonathan about Pathways and APE.
Yes.
So if there are no more questions, I think we can wrap up. We have a final slide just summarizing the due dates. And so I'll go ahead and share that with you. And I'll turn this over to Mary Elise.
Thanks, Hannah. Apologies for my presentation just not working at the last minute, but I just dropped two of the three links in the chat. And again, just to reiterate, in case anyone missed it, I will be sending the third link. That would be for the Lilienfeld. And I'll send all of this out to you all again so that you have the information. So just to review, we have the two opportunities via SIRF at the Georgia Department of Public Health. And the deadline for that is February 18th. There is a Qualtrics link that you can submit through, but if you have any issues at all, please email me any questions. And if you do have difficulty, like Hannah said, you do not have to wait to have the letter. We can waive that, but know that you would have to submit it if you are passed on to the next round. For Lilienfeld, it's February 28th. And as Dorian mentioned, you might be able to get a waiver if you're not able to get the letter, but I would encourage you to at least try. The contact for that, IPRCE@emory.edu. You can send any questions and the link will very soon be available. And then finally, the last one that Jonathan presented, the Pathways to Practice Scholar Placement. Tamira Moon is the contact, and the posting link I dropped in the chat and is available there. They would like applications to be submitted as soon as possible with a desired start date of May 2nd. So given that all of these are competitive, I would encourage you to get your applications in as soon as possible, and don't hesitate to reach out to any of us with your questions. Thank you.
Thank you so much, Mary Elise. And it sounds like we'll be following up with emails to everyone who registered. I think we had a question about visas and GDPH, and then perhaps updated links and applications. Thank you all so much, and thanks in particular to our wonderful GDPH colleagues, as always, for their great projects.
Yes, thank you.
Take care, you guys.